All right, let's go to the Western Cape now, where the Gift of the Givers is stepping in to help the people of Touwsrivier. It noticed a serious lack of medical supplies at a clinic in the small town. It means even something as simple but deliberating as a toothache can go untreated for weeks. Our reporter Nobesuthu Hejana is following developments, and she joins us now live. Nobesuthu, this story basically highlights, the fact that in South Africa, a lot of people actually don't have access to quality health.
Certainly, Masejo, the town of Touwsrivier has about 10,000 population of people, and we hear from the people that we spoke to outside who were saying that the clinic, that is the only one that's functional in the community. It sees about 50 people on average per day, and when they have serious matters, they have to call in ambulances or they have to transport people to nearby towns like Worcester and Dudons, and that will take up to 3 hours. So they're saying that it's been very hard, especially during the COVID period. But I'm now joined by Dr. Imitias from the Gift of the Givers. Doctor, the Gift of the Givers are here. It's a slight relief for the community. Tell us about your interventions.
We've been helping Touwsrivier from a social point of view for the last 2 years, since COVID-19 started, and predominantly supporting them with food for the soup kitchens, because this town has a 95% unemployment rate. And then, of course, when school started, we brought in stationery, and that was on Tuesday. And it was on Tuesday that we discovered there was a medical need in the facility, in the town itself. We didn't know that before. And that happened quite by accident. One of my team members saw a child crying, telling its mother that the tooth is very sore and it's battling for a long time. And we asked the principal and the community worker, where's the dentist? And they said, look, there's not much medical care here. There's a clinic, there's nurses come once or twice a week, and doctors come once or twice a month, or sometimes once in 2 months. So there is no, and the closest hospital is Worcester, which is an hour away, but people don't have money to go there. And if there's an emergency, an ambulance takes 3 to 5 hours to come. So we said, let us do a medical intervention to try to get an assessment of what this town needs and what's really happening here. And I'm very happy that we've come. There's a lot of children here, very brave, but I mean, they must be having a lot of pain, seeing each other getting poked in the mouth and getting the teeth pulled out, and they're sitting here quite fearless, which means they're suffering with their mouth.
And you obviously brought in about 50 medical personnel to assist. Is it only for today, or you'll be here for some time?
It's a one-off thing as a survey, so we can report back to the Western Cape Health Department to say what's required, because we'll have a fairly good idea of what needs to be done later, whether the clinic has to be supported further, or whether doctors should come in more often, twice or thrice a week, more frequently. So far, it looks like there's a big dental need here. We got, I think, probably 300 to 400 patients, mostly children, waiting for dentists. Fortunately, in the 50, we have 10 dentists. The other thing that's emerging here, there's a lot of people for eye testing, either just for glasses to see properly, and others requiring cataracts. Now, you can't remove cataracts here, and we don't have a system to test eyes here. So it may require a different clinic, an eye clinic, for the eyes itself. We've just spoken to somebody who's responsible, who's given a contract for eyes in the rural areas, and they said within a month's time they will be coming and they will take care of the eyes. So right now it's dentistry, it's eyes, both vision and cataracts. There's a lot of people for gynae, a lot of children diseases, old people and some youngest for orthopedics. So that's what it's looking at right now. But I won't know the stats, it's too early. But by the end of the day we'll have a fairly good idea. But overwhelmed dentistry and eyes right now.
I did try to get a response from the Department of Health in the province. They are said to release a statement later on the day. But I'm just curious as to some of the conversations that you've had with them regarding the state of medical in this particular town.
We didn't have much of a conversation, but when the deputy director from the area was contacted by the media, he or she mentioned there was a big need in the area. There is a big need, but the need, we need to ascertain whether it's need of serious conditions or general primary health conditions. Right now, it's primary health care conditions, but still it's important. Children can't be walking out with sore mouths for a prolonged period of time. That's not acceptable. And vision, why should people be suffering with eyes? It affects the reading, it affects the daily living. And so it helps us and it's a very easy intervention. to improve the quality of life instantly. So it helps us to know, let's bring our eye people in, and by the end of the day, we'll have an assessment. Is there any infectious disease problem here? Is there TB? Is there cancer? Is there high blood pressure? Is there diabetes? So by the end of the day, we'll have a fairly good idea about that. The MEC is aware. We spoke to her. We said, we're coming here. She sent a message to us to say, thank you very much. Government can't manage everything, so she appreciates the fact that we're here to assist. So we got a very nice message from her, and we got a very good relationship with her. So it's here not to outdo anybody or to show anybody up, to augment and to support and to take information back so better services or the appropriate services could be given to the people here.
Thank you very much, Doctor. Well, Masego, that was Dr. Imitia Suleiman from the Gift of the Give as well. I'm just going to step out of shot just to show you what is currently happening here. We see those medical personnel assisting the community. In fact, when I spoke to one of the residents outside, she was telling me that she has diabetes and she has a problem with her eyes. So when she went to the clinic, she was told that there is currently a list of about 100 people who are still waiting to be assisted. So she says with this intervention, she's hopeful and thankful that they came today. She knows that it's a once-off thing, obviously today, but she hopes that she will be assisted, and say that she is willing to wait up until 4 o'clock in the afternoon if they're required to, because that's how long they usually wait at the clinics around here, and they would sometimes leave without getting any assistance. So the Gift of the Givers in town assisting the community of Touwsrivier, but we will be waiting for that statement or response from the Department of Health in the province.